Today's show is slightly different to our normal shows. I'm not covering law as much. There will be some law involved, but my focus will be mainly on health and mental health, to be quite specific. Now, this has come about. I've decided to do a show on this purely. It's been a topic that's been in the news, etc., quite a lot recently, and also I'm sure many of you would have heard of the demise of Sushant Singh Rajput last week. Now, I felt that this is a topic which I need to do a show on and try and guide and assist our listeners with any advice that I can provide or any of my guests can provide. And to that, I've now got with me a psychiatrist, I believe a consultant psychiatrist. I'll get him to introduce himself and exactly what he does himself. So Kibaji, if you can come online and please tell us who you are and what you do.
Yeah. Thank you, Ajaz, inviting me in this show. So I'm Dr. Sukhcharan Singh. I'm working as a consultant psychiatrist. I have about more than 10 years experience in mental health, working in the UK. I work in NHS. So, as I said earlier, it's a privilege being here, talking about mental health issues, specifically in relation to, I think, the recent suicide in Bollywood, which has, I think, been quite highlighted in the news. So, yeah.
Well, there are obviously controversies as to whether it was a suicide or not, but that aside, I think it's our duty to try and do what we can to highlight this issue of mental health. I mean, mental health has many aspects to it, and I mean, what do you think are the causes of, for instance, depression? Because I suppose the starting point of mental health issues is probably depression. Yeah. Is that correct?
Yes, one of the most common illness of mental health, we normally can say depression. However, I would say better term is use low mood, which is, all of us has, or people do have in their life at one point because of the changes in lifestyle or circumstances. Sure. When we use word depression, it all more become clinical for us to, rule out is anything else going on or whether someone is suffering with the depression. So just to touch on a depression, several studied, I would say hundreds of thousands of studies have done to find out what really causes depressive illness. So I think the most common one people normally say is due to change what we call it neurotransmitter in our brain. So one I think most common one we call serotonin. So there is a chemical, I would say, imbalance, which I usually use to my patient this term. It's quite a layperson term. So chemical imbalance in the brain, which is I think most common theory we follow, has impact on our mood. So that's normally the cause of low mood, and eventually if someone has suffering with the low mood for significant period of time, I would say at least 2 weeks minimum, which is our criteria we use in mental health to diagnose someone with a depression. So there has to be a few symptoms, like definitely low mood, someone having low mood for any reason, It doesn't has to be any particular reason why someone feeling low mood.
So, I mean, I've got quite a few questions on this. I mean, but before I go any further, I'd like to ask the listeners and the viewers who are watching on Facebook and YouTube, if you have any questions, please either call the studio or WhatsApp us. The number to call is 01902 972 150, and the number to WhatsApp the studio is 07 440 420 432. The number's also running along the screen, at the bottom of the screen, when if you are watching us on YouTube or Facebook. Please, feel free if you have any questions on mental health. I will try and assist you, and as will our guest here today. Now, the next question I have for you is, as a layperson, of course, you've been practicing in this field for many years, so you are more likely to pick up on the symptoms and much easier than someone, for instance, like myself. So, how can I, as a layperson, tell if someone has mental health problems?
Um, Now it depends when we say mental health problem, what we are looking into, because there are several conditions which comes under mental health.
Right.
Just as we talked earlier, anxiety and depression, they are normally, come with each other most commonly. It's a very common one. I would say in a very simple way, it's not always easy to find someone when someone is suffering with the depression. However, we all, as individuals, we all have some baseline personality. Some people are normally introverts, some are very extroverts, some have, and some people are quite extrovert but still feel, they can of course feel mood changeable as well at times. So it is difficult. However, if we know someone, when we assess them, it comes to us whether there has been a significant change in someone's normal life routine. So that is the only possible when we know someone a little bit more. For example, we know a neighbor.
Yes.
So normally, if we get on well with the neighbor, we can tell, oh, this neighbor talks to me more oftenly, say hello, hi, all this. And we notice, oh, he's still at home, but I haven't seen that neighbor for a while, haven't talked to the person. Or when we see them outside, maybe they don't look in themselves fully. Maybe they're not interacting much. So that's something, yes, we can say there has been some change.
So,
Yeah.
say for instance, in a family, I understand your point with a neighbor. So in a family, I suppose you could say maybe mood swings.
Yeah.
So if you feel that your spouse or your children or your parents, it could happen to anyone. If they are not their normal self.
Yeah.
If normally they're quite rational, quite well level-headed,
Yes.
and if they're going through mood swings, that could be a sign, I suppose. Is that right?
Yes. Yeah, it could be one of the signs, because it is a family member now, so we know family member well, how they normally are. Now we have seen some changes. Yes, it could be. However, few days, mood swing, changes, mood, that happens quite reactive to our day-to-day life. That normally doesn't trigger assessment or referral, or so I think in that case we just normally just liaising or talking to family member, is everything okay, anything else. And if we clearly know, yeah, something happened socially, in terms of job, in terms of relationship, which has impacted that person, I think it's good to talk to them, which is the most important thing. people normally start feeling isolated. They normally don't talk much to others, which
That
yeah,
actually
doesn't help at all.
that actually leads me to my next question
Yeah.
quite nicely. Is how can I help someone if I feel that this person may have this issue? How can I speak to them? How can I help them? With this problem like depression or anxiety.
Yeah.
Are there any suggestions that you could give?
Yeah. So I think we are doing well, especially developed countries, in terms of stigma of mental health. Um, so people are coming out more or talking more about their mental health.
Mm-hmm.
In the past, it was very difficult. People were not finding it comfortable talking to others.
I agree, because people might think that they're, as in the Asian term, pagal ho gaya.
Yeah,
Right?
बिल्कुल,
Right.
yeah.
ये बंदा पागल हो गया, इन्हू पागल खाने भेज दियो. Right? So it was a lot of stigma attached to it, and in recent years,
Yeah.
things have changed.
Yeah.
I mean, I've noticed from people around me as well saying that. I mean, I remember this one where I used to work. There was a colleague who claimed to have depression, but around us he was fine.
Yeah.
We never saw anything different. But I guess it was something at home.
Yeah.
And it's just, we could not tell any different. We could not tell any different until he came openly out with it. As, I've got depression. I'm suffering from depression. Then he started seeking medical help, counseling, etc. So it's very difficult. I think, we worked with him for years, and we couldn't tell any different. But at the same time, I also feel that he may have felt better in the workplace because he wasn't hiding it per se, but maybe it was helping him.
Yeah.
Maybe that helped him.
Yeah. I think that's a very good point, Ajaz. It's not it's not uncommon to see people presenting differently in a different environment. Sometimes work is a respite for them. People who are really enjoying or just doing well at work, and for some people it's the other way around. Any issue at work, or they don't like just enjoying the work what they're doing, they're normally more distracted, they're more able to cope with work, and they may be different at home. They feel better at home. So I think it is a different. However, in depression in general, not every case, person should be presenting nearly same
Yeah.
in the different environment,
Sure.
which class as a depression, because it is normally not straight away changed by different environment. However, distraction due to family life, due to friends, colleagues, or any activities they do helps
Sure.
to improve. And yeah.
One second. I believe we have a caller.
Yeah.
1 second. Hello.
I would like to talk to Ajaz, please.
Speaking. Hello.
Ajaz, how are you?
I'm good,
just
thank
say good
you.
morning.
I'm
Good
good, thank you.
afternoon.
Hello.
Can you hear me?
I can hear you now. Yes.
Yeah. Line was a little bit bad there. Do you know what I'm going to do? I'm going to... can you guys hear me?
Yes, we can.
Okay. Yeah, I was just ringing in and just to give a little bit of feedback on what you guys are talking about with regards to mental health.
Okay.
My name's Zaid Shah. I'm known in Wolverhampton, and I was just listening to what the consultant, the psychiatrist, was talking about, and it just sort of inspired me to call in and
Sure.
just sort of make people aware of how mental health is looked at within the Asian community. I myself, roughly around probably about 15 years ago, maybe longer, um, had really severe depression, and it was all I think people need to be aware. There's always some sort of trigger factor.
Mm.
Uh, my trigger factor was one of my cousins and one of my best friends. He just, I was with him 1 minute, and then next day he was dead, right? And it was just, the it really took me by surprise, and straight away I was in a state of shock, and I just couldn't get out of it for ages and ages, and this led to some severe depression, and I went to see my GP, and I think the consultant's right. It is something to do with serotonin levels, and I was prescribed SSRI. I was very fortunate that I knew a few consultant psychiatrists, and I went and spoke to them, outside their work times, and got some sort of counselling. But I didn't take the medication. What I did was the doctor's not going to be happy with me here, but I went along the route of just changing my diet, getting myself fit. But it's not as simple as that, because it took me years. It took me a good few years to get myself out of it, because I'd always go back into low mood swings, and there were times, suicidal thoughts where you just feel like just getting into a car and just finishing it off, driving to the wall or something like that. For me to express the views, it's just I want people to know what Asian maybe males are going through, or even females are going through, and nobody understands. People in the family thought I was tapped, mad.
Did you have any support
the
in the family?
Yeah, my wife was the only one who supported me. She I'm not saying my mom and dad didn't. They just didn't understand it. And my wife was the only one. She understood what was going on. She could see. She was talking to me on a regular. She was encouraging me, motivating. She'd actually force me and say, go and play sport, go and play cricket. You love it, and that kind of thing. And in the winter, she'd say, go to the gym. She'd like say, look, you need to go out there and talk to people, and that kind of thing. And it was tough. And I think if it hadn't been for my faith as well, being a Muslim, and in Islam, as you know, it's forbidden to commit suicide.
Yes.
There were those, thoughts going through my head on a regular basis, maybe 3 or 4 times a week, and it was tough. It was tough, and I got myself out of it. But the doctor will back me up here and say that you don't completely get yourself out of it. You just get stronger on dealing with it. Now, you mentioned one of your friends, and now a few years later after my episode, one of my nephews in Wolverhampton, he started to get, I could see he was starting to isolate himself like I used to, and then go away into a room and stuff. And I realized from his body language and his face, I could tell there was something wrong. So I went and started talking to him.
This is because of your past experience yourself, yes?
Yeah, because of my past experience. And I'm not a doctor, so I'm not trying to be a consultant psychiatrist or anything. But I sort of got, saw what was going through, and I started to go down to his house every day, and we used to go for walks, and we used to talk about it. And he came out of it a lot quicker. But his father, he said to me, this guy is lying. There's nothing wrong with him. He's perfectly fine. He's just making it all up. And this is,
I think that's often the case with our parents from the generation before. They don't see this as a real issue.
No, they don't. And it was until a few years later that my wife spoke to my family about it, and then my cousin's, my nephew's father, he realized just recently, when he was unwell himself, that, my God, there is something out there called depression, and maybe I underlooked at what was going through with my son. And I think my nephew was lucky that, that I was there and supported him, guided him. And he came out of it really quickly because he had somebody to talk to. He'd be ringing me like 4 or 5 times a day, and talking to me and how he's feeling. And he needed somebody to talk to. And I think that's one of the factors. And there's loads of other factors. Obviously, you have low mood swings and the thoughts that go through your head. But it's horrible. I'm telling you, it's such a horrible place to be,
Yeah.
right? And you can't. Sometimes you don't know what to do. You're just stuck in that little box, and you're trying to get out of it, and it's so difficult. You know what I mean?
No, I understand exactly where what you're saying, and it's one of the reasons I decided to cover this topic, is because to a certain degree, I suppose there is still a stigma attached to the to mental health, and we need to get out of that mindset. Our generation needs to move on and accept that this is an actual issue, and assist the people who have depression, who have anxiety, who are suffering from mental health, to get back to as normal as possible. But yeah, thank you for sharing your story, Mr. Shah, and it's quite brave of you to come on the radio and tell all our listeners of this. I think.
So yeah, Mr. Shah, I think I'm very glad to hear that you improved without medication, which is a really good thing. I'm not sure if you know about guideline. Of course, we follow guideline unless this is something very atypical case. Normally, what we call mild to moderate depression doesn't require any medication.
Yeah.
So always lifestyle advice, speaking to colleagues, good diet, going out, speaking to family members, coming out from this stigma always help. Because there are some societies, there are some groups, they have quite less prevalence of depression just because they quite mingle a lot, they talk to each other more. And I think we are
Yeah.
in a society now, in a society where isolation is very common. We are a nuclear family away from parents. We don't have many people to talk to, and depression just,
Sinks
kind
in.
of ingrained, in ourselves. And we actually get to the point when we really struggle, and that's it. But I think glad you did very, I think, hard work, because it's not easy for everyone to speak out. Especially, yes, medication, yes, has it all, but it comes. I work actually in inpatient. We mostly see patients who have really gone quite far, feeling suicidal, that stage when GP cannot guarantee their safety in the community, so they come to us. So but I think you did it really well.
Yeah.
No, thank you very much. And one thing I will say is that the psychiatry department in Wolverhampton, they do a brilliant job. So I don't want to take anything away from you guys. I mean, I did speak to guys who were at New Cross Hospital, who were friends of mine, and psychiatrists at that time who got me through it. And you guys do a wonderful job as well. I'm not going to take anything away, but it's.
Thank
Well,
you.
if it helps, Mr. Shah, Dr. Singh is actually not at New Cross. But I do know.
I don't know, because it's been that long since I've spoken to somebody from that area. But yeah, I mean, I think Dr. Singh might know Dr. Jafar Qureshi used to be.
Not really.
around-
Actually, I'm
around
very
back
new
then.
in Wolverhampton, but I don't work here, so very minimal contact with the other clinicians here in this Midlands.
But yeah, there are quite a few psychiatrists in Wolverhampton. I know a few, in fact. I believe one or two are actually listening in as well. I can see on Facebook. So if they want to call in and give us some extra advice, we're all open to any other ideas and suggestions.
Thank you very much.
Right, thank you, Mr. Shah, and and keep listening.
No problem. Thank you. Bye.
Right.
Good show.
Thank you. Right, that was an interesting story. Yeah. Now, the point that we were talking about is how can someone help someone? How can you help someone? How can you speak to someone about it? I mean, the few of the points that you've mentioned, encourage them to seek help. Yeah. So obviously, it's once you see that there is a problem, may not be mental health, but there is a problem, it's always good to seek help first, which is a valid point that you raised. I feel, going back to my previous situation with my colleague, had we blamed him on, say, oh, you're it's nothing real. You're trying to pull the wool over our eyes for your shortcomings, etc., and blamed him. Of course, that wouldn't have helped, would it? So,
Yeah, I try to explain to my patients. We all, I don't think there is a immune from mental illness, even low mood, anxiety. We all come across at one point in our life when we feel low in mood. Um, so, however, yes, it changes possibly quite quickly because of the environment, because again, people have different, all we have different individuals, we have some different strengths, different abilities to cope well with particular things. So very few people who cannot tolerate in a healthy way or just in a normal way, they come to the attention of services. So it means there are people are doing things by self, which has helped them. So that's why we don't see, too many people or flood of people coming in hospital. So there are people, yes, who cannot tolerate, like any other, even physical illness. So many patients just improve. For example, even have a cough, temperature, cold, they improve at home. That's it. Some people not. They continue to get worse. They eventually need help with physical health. That's same with mental health. If symptoms doesn't disappear and start getting worse, I think that's a time
to seek help.
Yeah, just to seek help. Again, we have GPs. Is very quickly we can get appointment. Speaking to colleagues, because it's difficult when you come into this, because GP at least doesn't have this kind of stigma factor. Neighbors or other people around you or family may not understand you fully. If you're thinking you are really crossing the line now, when you are start putting yourself at risk somehow, maybe not eating, drinking properly, your sleep pattern, your life has been affected by your activity of daily lives is not there anymore, or you're just struggling with everything day-to-day life. I think that's a time to ask for help.
But if you're that neighbor, that family member who's seeing a change in this person, sometimes it takes a lot for a person to say, I need help.
Yeah.
So, sometimes would it not be better for, in some way or another, for you to bring the subject up, to say, look, I've noticed a change in you, right?
Yeah.
Can I help you?
I give you example. My next door neighbor, for example, I know him, but I don't think I know him that much that I feel comfortable saying this thing, that I have noticed a change, and I would be, commenting on his. Ajaz is smiling at me.
I also live close to Dr. Singh, so right opposite him.
So I'm not talking about him, I'm talking about another neighbor. Just giving an example. So I will definitely come forward if any changes in Ajaz, definitely for sure. And he would do same to me as well. I would really appreciate that if he do to me. But I think that shows how much we really care about each other. I know this is stigma, but I think we always find difficult. Even I would still find difficult being a psychiatrist if I see changes in someone, my neighborhood. There's a change because I don't have that rapport, I don't have that relationship, because we all feel how that person going to feel if I'm going to ask such kind of questions. But this is very personal to people, and there is a stigma attached, and I think that really make it difficult. However, yes, we can somehow, if there's any way of saying it, are you okay, haven't seen you out for a while. Now it's up to that person. If they feel connected, if they can talk to you in a little bit more, I think then maybe we have some opportunity to say, is there anything I can help you, rather than saying, mental health, just getting you something. Or if it is, I'm like someone who's older family member, just you ask them, is there anything I can help you with shopping, something. So at least they have something there, maybe trigger, because
they feel that someone's there for them.
Someone there for them.
Yeah. So I guess it's always good to be patient with them as well. Someone with depression may get more irritable.
Yeah.
And may misunderstand what you're saying.
Yeah.
Sometimes you may want to say one thing, but they take it in a different way.
Yeah.
It's a common fault in Asians anyway. But yeah.
It's very sensitive. So
yeah.
It's a very sensitive matter, especially when we don't know someone well. So in that
Yeah,
case, we
exactly.
have to be.
So they'll need
Yeah,
reassurance.
yes.
So I would also say that, you may feel that one of your friends, colleagues, neighbors, family member is suffering from such illness, but you should also look after yourself.
Yes, yeah, that definitely.
Yes, it's good to look after your neighbors, good
Yeah.
to look after your family
Yeah.
members, but your health matters too.
Yeah, it is. Again, I said, no one is immune. Even when we talk to patients, they sometimes say, "Doctor, you haven't come across this kind of illness. You can't say this." Yeah.
I think we're heading into a break. Sorry, I felt we were going into the break, but the break, we've actually been talking through the break. But I'm sure we were live on Facebook at the very least through that. So what we were talking about was how can you speak to someone who has depression or anxiety? So the points we raised was to encourage them to seek help. To don't be afraid to bring it up with them, but be courteous to their needs. Don't blame them for anything.
Yes.
Be patient and be patient with them because they may be irritable. And finally, we mentioned that you need to make sure that you look after yourself as well, because that's very important. You don't want to be in the same situation. So, helping yourself. I mean, do you want to come in there?
Yes, as I was talking, because sometimes patients ask me, "Doctor, it's very easy for you to do this and that, because you may not have suffered with such condition I'm suffering with." So I always try to explain to them, yes, I haven't got experience, seen patients with similar problems, but we are not immune. No one is immune. Even, yes, I come across a low mood sometimes, but that's is a normal for everyone, because it's quite reactional to our circumstances and what we do, what our lives are. However, we're talking about a particular person now, because that person is in hospital, and I'm there to listen to them. So it's, I think, but again, it is always good when you talk to patient in a nice way. I think they really feel to listen, and I think it works as a placebo effect as well when they have spoken to so many people, and especially in hospitals. There are other staff around. They spend one-to-one time with them, which really helps. And I have seen patients being discharged from hospital without any medication as well, because we do not start medications straight away. Again, it depends. We may treat them symptomatically if they are struggling with this sleep. Sometimes sleep deprivation is a quite big major factor, which again due to some trauma happened or something happened, they're struggling to sleep, and then it contributes more and more into depression. So improving sleep sometimes help. Some education about diet, try to eat rather than starving themselves. That helps as well, because so there are multiple things we do. Talking about if they need any kind of help in a social aspect, which we can, which is in our limits, we try to sort out that as well. Maybe help them with some community workers who come and talk to them, referring them to talking therapy, which is again one-to-one time with someone for some time in the community, which really helps. Yes, as I said, medications are there as a last resort. In primary care, like in the GP settings, they normally don't. They encourage this healthy lifestyle, which improves. If things are consistent, not improving, yes, they do introduce medication. There are some evidence that medication help with this neurotransmitter in our brain, which sometimes can cause depression. So yeah, all these things we do.
So, if it's an emergency, I mean, the point I want to raise here is that I want to move on to back to suicides. Now, in 2017, we lost 5,821 people to suicide in the UK. Now, this is an enormous number of people. And every one is a tragedy. So, can they be prevented with the right support in place?
Suicide. Yes, there are. Okay, mental illness. Yes, do sometimes lead to suicide. Not always.
Mm-hmm.
However, sometimes suicides are quite reactional to their circumstances, what they're going through.
Sure.
If someone have an argument at home, they have some social issues, even a patient is not known to any mental health, not been having any treatment, just a normal individual who never come across under anyone and never suffered with a low mood or depression, can commit suicide. Because it is more, I think we do see in the news, something happened to someone's life, maybe a relationship, maybe financial loss, maybe other things, and we see, they commit suicide. So it's not always the end of, or due to depression. That's what I want to say, or due to other mental illness like schizophrenia or bipolar. So it's difficult to say. That big figure of suicide, maybe I think 10 to 15 people a day, at least, I would say. Maybe at least 15 people a day committing suicide in the UK, which is a very big figure. Living in a developing, country where, I would say we are very lucky in the UK. We have very good mental health support, especially in the community.
I think the figures state that suicide is the single biggest killer of men under the age of 45 in the UK. So that's
it's a big thing. Yeah.
It is a big thing for for men especially, single biggest killer.
Yeah. So again, just to highlight, for example, as I said earlier, we do come across with patients suffering with a low mood or depression due to one of their close family member have committed suicide due to and never been under mental health services. They never noticed any change. It all just happened within a day or within hours. Someone just decided this and jump off the bridge or something else they did. So I think it is quite reaction as well. I think we shouldn't take all due to mental health. Yes, mental health is a biggest factor in this. But it's sometimes due to anger, due to frustration, due to the things that happen as well.
Yeah. So yeah, that was quite a lot to take in there. It actually reminded me of someone just now when I was thinking of suicide. When I was younger, in primary school, I went to school with this lad who was in my class. And I think when we were about 18, 19, I met him after school as well. Nice, really nice guy. I don't think that he ever upset anyone in his life. But he hung himself. I think it was when he was about 18, 19 maybe. He hung himself. He went to his garden shed and hung himself. We still don't know why. But obviously, we weren't so well versed on mental health back then. In fact, sorry, that's brought a tear to my eye a bit, just thinking about it. So, yeah, Allah's good jannat nasib kare. So moving on, I wanted to add a little bit of law into it, seeing as it's a legal show. So, I mean, what does it mean to be sectioned? I think you probably know more on mental health law than I do. Yeah. I'll try and come in as and when I can, but obviously you dealing with such matters on a regular basis.
Yes. So people who suffer with mental illness, could be any condition they're suffering with, if they are putting themselves at risk due to mental disorder, so which has to be defined by by the profession, what is mental disorder, and due to that mental illness someone is at risk, or someone putting other people at risk, maybe due to self neglect, if they're harming self, or they are harming themselves, or if they are trying to harm other people, or causing anything which is due to mental disorder, to treat them, because it's very common they do not have insight or understanding into their mental illness. This is the nature of this illness. People have poor insight. They do not think they are unwell or they need treatment. They don't think they're posing risk. So as a clinicians, we have to decide when we assess them, or this gentleman is suffering with some mental illness and there is a risk, so we put application for detention.
So basically, they are kept in hospital under the Mental Health Act. Is it Mental Health 1983? I believe
Yeah,
it is.
that's Mental Health Act 1983. It was revised. Few changes made in 2007. I mean, revised 2007. Few important changes made into this. So yes, when they detained, they have to be in a hospital, which is called a safe place, for further assessment, and treatment. For up to, okay, now when we come to sectioning, now I know it depends.
Are there different types of sectioning?
Yeah. So there are, again, I don't want to go in whole detail because there are few sections we mainly use on day-to-day basis. I think most common what we use, which we call section 2. There have to be 2 psychiatrists and 1 approved mental health social worker. So 3 people have to be there to assess that person, to decide whether the person needs detention. So if we think the patient is detained, we always offer the patient wants to come informally or as a volunteer patient in hospital. So we always respect it should always be least restrictive option we choose. But in some cases, no insight, patient doesn't want, we have to put on section 2, which lasts maximum up to 28 days. So patient can be discharged within 2 days, week, or up to 28 days maximum. So in that, during that time, again, it all depends on individuals, how unwell or well they are. They are generally not allowed to leave. However, if they start doing well, risks are minimal. Things have changed, which is very common. Things change within hours. There are few conditions, they affect you very quickly and they disappear very quickly as well. So we assess them and they start going out, and we assess how they are in the community, and we eventually discharge them with some support in the community or under his GP's care. So that's the one section 2, which very normally we use.
So there's obviously the section 2, section 3, and section 4.
Yeah.
So as you've said, section 2, if you have a mental disorder, you need to be detained for a short time.
Yes.
For assessment and possibly medical treatment.
Treatment, yeah.
And so it's necessary for your own health and safety and for the protection of other people.
Other people. Yeah.
So do you say it's up to 28 days?
Maximum.
Maximum,
days,
yeah. So that's up to 28 days. Do you want to briefly tell us about section 3? Or?
Yeah, section 3, again, I have to talk about these 2 sections. Section 3 is, again, it's not uncommon. Someone needs longer treatment in hospital and they're still not well and still risks are there. So we make a request as a psychiatrist. We have to make a formal application that I want this patient to be stay on longer on ward, and
So the difference between section 2 and 3 is really that they need treatment can't be given unless they're detained in hospital, I suppose.
Yes, yeah.
So is that up to 6 months?
Up to 6 months.
Yeah.
Maximum, yeah. But again, it can be taken off after a day, after a week, after, depends how long they need to be in hospital.
Yeah.
some cases, this section 3, when we think patient is still unwell, because some mental illness are very chronic, risks are always attached to that. This another section is called CTO, Community Treatment Order. It is technically a section 3, but in the community. So the patient can be discharged home or the suitable accommodation with some condition attached to this. For example, patient need to take medication, need to attend the appointments, need to meet their community and psychiatric nurse. So this is a similar section,
Sure.
section 3 in the community as well.
Yeah. And as far as I know about Section 4,
Yeah.
the maximum, is it 72 hours?
Yeah, so it again, not all cases, especially nighttime or early mornings or difficult situations, we do not have two psychiatrists who can assess the patient. So we have one psychiatrist and one social worker, mental health social worker. Only two people can assess. So they can put this on section 4, which can only
So
last
waiting for the
70
doctor to
yeah.
confirm.
So then within 72 hours, there have to be another psychiatrist reviewing the situation, either discharging the patient back or putting or converting to more likely section 2.
Right. Okay. Okay. Well, that's.
Yeah.
That, I believe that's the legal side of things covered, as far as mental health is concerned. Now, what is a personality disorder?
It's very wide topic actually. Again, the personality refers to how our thoughts are, how we feel, how we behave, and this is each of us, the individuals, what we are. Now, when we use word disorder, now personality is normal, everyone has a personality. When it comes to disorder, so extreme of everything, which start putting themselves or others at risk,
At risk, yeah.
that I will use the word disorder. It means it needs some kind of attention or treatment. For example, some people do take some risky behavior. They involve risky behavior. For example, maybe give you example, driving fast, breaking some rules, traffic rules, this and that. Now, yes, we all normal human beings. Sometimes we make mistake, but I think when it comes to remorse, learning from our mistakes, keep doing it up to the level when you are completely putting yourself, other people at risk. You are harming yourself in somehow. You are harming somehow other people. The problem with the relationship issues, which again we all have some issues, at one point, but again it becomes quite extreme. They do not take it as in a light way. They feel completely abandoned. They have very poor self-esteem. They start feeling low as well. Again, there are lots of difference being depression and then low self-esteem here, because they changes quite quickly. Because in personality disorders, again, there are many types of personality disorders. For example, dependent personality disorders, anxious avoidant personality disorder, emotionally unstable personality disorder. There are a few types. Depends what symptoms they are suffering with. So it's kind of an extreme of someone's behavior, which putting themselves at a risk.
Yeah.
Now, in most cases, it's more kind of ingrained from your background, your I would say some genetics, yes, has been involved in this. There's some evidence. Your childhood, some trauma, abuse, bullying, use of drugs, street drugs. There are lots of contributing factors that add to personality disorder.
Right.
So that's very very layperson definition of personality disorder.
Right. Okay. And then we also have PTSD, post-traumatic stress order.
Yeah.
I think that's quite a big topic in itself.
Yes.
So we've only got 6 minutes, and a few more questions I have here for you. So if you want to briefly, explain what that is, what the term is.
So again, I think term itself explains someone have a trauma, and then after the trauma, even it can, after even till a few years, someone start reliving in the same event. They start having flashbacks of that traumatic event, and that eventually trigger to mood changes, lack of sleep, lack of poor appetite, their lifestyle changes. So they eventually become very anxious. They struggle. So that we normally use post now. It is very common in army personals, because they deal with the in army the things which is really not, no one to do it. So they have flashbacks, very common. Again, it is, I think it does need attention at one point. Some people have very minimal symptoms. They somehow cope well, sport with our family, and again, but when it's come to GP or things, there are medications help with symptoms.
Yeah.
I don't think there's any
So,
medication.
which leads me to
Yeah.
the next question: are drugs or therapy better for mental health conditions? Which would you say,
Are we
or,
talking
or
about general mental health condition, or are we talking about PTSD?
in general?
General, um, there are certain conditions. There are strong evidence that drugs are beneficial. They need to start, I think, sooner than later. But most conditions, depression, PTSD, anxiety, OCD, obsessive compulsive disorder, personality disorders, I think is more like talking to someone. Talking therapy is very important. There are a few types of talking therapy. It depends what kind of
So
therapy needs.
yeah, so different people may need different, may be able to manage their mental health in different ways, I
Different
suppose.
ways.
So some would obviously be, as you say, talking therapy, and some maybe, well, antidepressants. So I feel nowadays you hear a lot of people get, prescribed antidepressants quite easily.
Yeah.
Quite, they go in and say, "No, I'm feeling low. Here's antidepressant."
Um, it varies from individual to individual clinician, to be honest.
Yeah.
Um,
I suppose it can be effective for some people,
Yes, it can be effective, but as I talked earlier,
but it's not a solution.
it's not the solution. It carries so many side effects. I think which we call these medications for mental health, they tend to have far more side effects that we normally have other medications like antibiotics, painkillers, and all these routine medications. So we have to be very careful with these medications, because sometimes they make you even more sedate. They become drowsy on this. Then your motivation decreases even further. You cannot go out. Your appetite get affected. So yes, medications are there, but again, it has to be individually assessed. If someone's struggling with sleep, they might need for something to sleep. So
Okay. Well, as we're coming almost to a close, next thing I want to cover quickly is the best way to improve someone's mental well-being. You mentioned diet before.
yeah,
So the right diet, eating fresh fruits and vegetables, I suppose, would help. Nourishing your mind and body.
yeah,
Sleep.
yes, very important.
Yeah. So yeah, is there any guidelines on how much sleep someone should have?
Again, people normally talk about 6 to 8 hours sleep at least. Again, some people feel as long as you feel fresh,
Yeah.
even after 6 hours, even after 4 hours.
Yeah.
I think as long as you feel fresh, then that's a sleep for you.
Yeah.
Yeah.
So anyway, then I suppose being outdoors nowadays, being in lockdown conditions, that's definitely having an effect on people.
Yeah.
So try and be outdoors as much as possible. Try and
Yes.
combine the mixture of, I don't know, I'm being quite so colors, sound, smells. It all helps.
It is. Yeah.
Yeah,
Yes.
and exercise.
Yeah.
Exercise is a big one.
Yes.
So yeah. So if someone feels quite low sometimes, should they see a therapist?
If someone feel low and they have historically felt like this and it has improved within days, I would say it should be okay. It's good to talk to family members or just routine things.
Or maybe visit their GP?
Yeah. I would say with feeling just low for a few days, I would not recommend GP straight away. I think I would recommend, yes, if you think things are not getting better after a few days and they are tend to get worse, even there's a trigger, even there's no trigger, I think yes, they need to ring GP.
Okay. Right, guys, I think that brings us almost to a close. I've got a reminder here. The first Saturday of every month, Sister Ajaz Ali, so she's a cognitive behavioral therapist. Now, she has a mental health show from 1 p.m. to 2 p.m. So with guests from the psychological profession. So please tune into her shows. Obviously, there's a lot to take away from these. Anyway, that brings us to an end. Thank you very much, Dr. Singh, for coming in and helping us. See you guys next week with a new topic I hope to be covering. Thank you and Allah
Thank you
Hafiz.
for having me.
You're welcome. Thanks.